Step 5, birthing positions. So there have been lots of reports of people being forced into certain positions or coerced or manipulated into getting into a specific position while giving birth, usually the position that is most convenient for the doctor. I was scrolling through Instagram one time and I saw this video of a woman who was giving birth. She was standing up and kind of leaning over the bed, and the baby started to come really fast. And the nurses surrounded her and said, "You can't push standing up, but not like this, okay?" The mother ignored the nurse and just went on to give birth to her baby standing and caught her own baby. You go, mama. But seriously, how rude is that? There's nothing wrong with standing while giving birth. It's just maybe not as convenient or as comfortable for that care provider. Care providers should be trained in supporting people and birthing in any position that they choose. If a care provider isn't comfortable with a certain position, that's on them, not on you. You know what position is best for you to birth your baby in. Whatever position your body naturally guides you into is probably the best one to prevent tearing anyway, because it's the position that you feel the most comfortable in and the position that you feel that you can cope with labor the best in. This is why I encourage people to have a conversation about birthing positions with their care provider before they go into labor, just to make sure that they're not going to enter into a dynamic with their care provider where the provider isn't supporting them and birthing in the position that feels best to them. There are only a few reasons why a care provider should recommend you switching positions in labor, but even under these circumstances, you shouldn't be forced. One is if the baby's heart tones start to drop. Sometimes that can happen if the baby is compressing on the cord a little bit in labor, and a simple position change, usually shifting into hands and knees, that allows the baby to have more space in the pelvis, will resolve this issue. Another possibility is in the case of a shoulder dystocia, which is when the head is born but the shoulders are stuck inside the pelvis. In this case, switching into a different position, also usually hands and knees, will help create more space in the pelvis so the provider can help get the baby out in time. If a shoulder dystocia were to go on and not be resolved, it could be life-threatening to the baby. But even in the case of an emergency, care providers should communicate to you compassionately and calmly, and your right to choice should always be intact. But if you're birthing in a care provider pool that rotates from a bunch of care providers, it's unlikely that you'll be able to meet all of them during labor or be able to really get to know all of them to the degree that you might want. One may be agreeable to your birth preferences, while the other not so much. Reading reviews for every provider who may support you in labor is essential. I also encourage you to do your best to meet with all of them or write an email to all of them asking them questions. If you have any concerns about being restricted with your position during birth, I really encourage you to share your concerns with your provider. Illustrating your preference to have freedom of choice for your birth position on your birth preference sheet is important, as well as having your doula or other support people know that that is something that's really important to you so they can help advocate for that for you when the time comes if needed. So, what positions decrease the risk for tearing? Royal College of Obstetricians and Gynecologists says your healthcare professional will work with you so that you can birth in your chosen position. A kneeling or all fours position or lying on your side may be beneficial and reduce the severity of tearing. I don't love this, and here's why. First, they can't guarantee that every provider will work with you to find a position that feels good for you. It's your responsibility to take steps to find a care provider and create an environment that supports you in feeling comfortable and choosing the position that feels best for you. We can't blindly trust all care providers to practice in the way that they should. Second, these positions do decrease the severity of tearing, but what about preventing tears altogether? Since most people in the US tear while giving birth, tearing has become the norm. In the US, I've noticed that we tend to normalize pregnancy, birth, and postpartum experiences that are in fact not normal. By doing so, we fail expecting families. So let me give it to you straight. The rate at which people tear while giving birth in the US is not normal. Tearing does happen sometimes, and it is also preventable. Perhaps if providers could lower the rate of interventions such as forceps, vacuum, hands on delivery, and episiotomy, and instead implement methods to decrease the risk for tearing, the rates of tearing and perineal trauma would probably decrease. So, when you're considering birthing in a position to decrease tearing, the most important factor to consider is if you're tolerating labor well in that position. There are certain positions that statistically reduce your risk of tearing, but if you're not comfortable in those positions or you're not coping well with labor, chances are they're not the best position for you. Birthing your baby in a slow and controlled way is the best thing you can do to decrease your risk for tearing. So, I invite you to learn about the different positions that statistically are best to prevent tearing, but don't choose just on these positions alone. So, here are some questions you can ask yourself or your support people can ask you when supporting you and getting into a position that's best. How do I feel in this position? Can I surrender to my contractions in this position? Can I rest between contractions in this position? Can I soften my pelvic floor and allow my baby to pass through in this position? If you're physically uncomfortable or you're struggling to relax, it'll be a lot harder to let your baby pass through your body slowly. When your baby comes to crown, you want to slow down and allow them to stretch that tissue for as long as it takes. You may find that allowing this to happen is more difficult in one position than another. For me, being in the water helped me to relax while pushing. The water held some of my body's weight, so I was able to relax and fully surrender when my baby was crowning. So let's go over the evidence on birthing positions without epidurals. Evidence-based birth compared several meta-analyses where people were randomly assigned to upright positions in the second stage of labor. They found that upright birthing positions decrease the likelihood of episiotomy, decrease the use of forceps and vacuum, decrease the risk of severe perineal trauma, and may shorten the pushing phase. However, they did find that upright birthing positions increase the risk of second-degree tears. An upright birthing position can be squatting, sitting, on a birth stool, kneeling, or standing. Speaking of standing, a Swedish study by Elevander et al. In 2015 found that the highest rates of perineal tears occurred in people who delivered in the lithotomy position. In this position, the person is flat on their back with their legs wide open. They found that the lowest rates of perineal tears occurred in people who were standing. So if you're having a normal physiologic birth, an unmedicated birth, and you want to get into a position to decrease your risk of tearing, being in an upright position or lying on your side is much better than lying on your back, especially flat on your back. If you are going to lay on your back, being in a reclining position is much, much better than being flat on your back. I think the reason why squatting increases the risk for second-degree tears, meaning the tear rate is lower, but if you tear, it's more likely that it's going to be a more severe tear, is probably because the whole body is stacked on the pelvic floor, and that's a lot of pressure on the pelvic floor. In an upright position, like standing or hands and knees, that doesn't put a lot of pressure on the pelvic floor might be better for decreasing the risk of tearing, and if you do tear, it would decrease the severity of the tear compared to squatting. Now let's talk about the evidence of birthing positions with an epidural. Evidence-based birth shared a Cochrane review from Walker et al. That included 8 trials. They found no difference between upright birthing positions when it came to the length of the pushing phase, the use of forceps and vacuum, and perineal tears requiring stitches. In one of the trials, they did find that side lying with delayed pushing significantly increased an intact perineum, 40% versus 12%. So in the side lying position, the person giving birth can hold their knee or someone else can hold their leg up while they push. Delayed pushing is when the person birthing waits to push until they feel the urge to push. Some care providers will perform a cervical exam, find that the person is 9.5 to 10 centimeters dilated, and instruct them to begin pushing. But the person birthing might not be ready to initiate pushing, as the baby might not be low enough to stimulate that reflex to help them push, or maybe their cervix is not completely out of the way. So if the baby and the person birthing are both tolerating labor well, it might be beneficial to actually wait to begin pushing. You can also turn off or turn down the epidural if you want to feel more sensations when you're pushing. This will help you deliver in a more slow and controlled way. A trick for pushing with an epidural is to change positions frequently. Switching between an internal rotation of the thigh position to a side lying position may support the pelvis in opening the outlet where the baby is exiting through and creating more space in different areas of the pelvis as the baby is working through it. When the baby nears crowning, based on the evidence we have, and if you feel comfortable in this position, I recommend birthing in a side lying position to decrease the risk for tearing. As a baby comes low in your pelvis, putting your knees together, but only with your heels wide apart, gives space. Turn your toes in to twist your thigh and widen your sits bones. This is called internal rotation of the femur or thigh bone. Now, baby has an inch more room between the sits bones, which are the ischial tuberosities, spinning babies. And that concludes our course on the 5-step process to preventing tears. Make sure to look at each of the lessons for attachments to the modules, links to different research that I reference, and guided meditations to help you prepare for pushing. If you want to learn more about how you can have a peaceful, empowering, and beautiful birth experience, click the link below to learn more about my 5-step process to peaceful birth. Just as I have a 5-step process to preventing tears, I also created a 5-step process to support peaceful birth, and it really works. And just remember that your body was made to do this. You've got this. Please reach out to me if you need any more support. I'm here for you, and it's an honor to show up and support you in whatever way I can as you go through this journey of bringing your beautiful baby into the world. Much love.